third and fourth tarsometatarsal joints are fractured. They are dislocated, and the cartilage is essentially smashed in those regions. So there is really only one reasonable treatment for this, which is a primary arthrodesis of your midfoot.
What does that mean?
And that's the fusion here through the middle part of your foot. You can fix anything, but the chance that you are going to develop arthritis is extremely high with this spectrum of injury. And I think any reasonable orthopedic doctor who does these kind of surgeries would tell you, have a fusion. I think it's your best chance of regaining your previous level of function.
Really?
Yes. Now, this is a complex injury, so you may never forget that this happened. Even with a well-done surgery, even with a solid fusion through your midfoot, I think you'll do well. But this is a significant, car versus motorcycle, sidewalk. This is a big deal. And your foot may, even with a well-done fusion, you may never forget that this happened, ever. Even if everything goes perfectly.
Everything goes perfectly. How long before she can do her half marathon?
6 weeks non-weight bearing, 6 weeks to 8 weeks in a boot of walking, but you gotta take it easy. Typically by 3 to 4 months, I think you could be walking, maybe in a shoe with an arch support. I think, and everybody's a little bit different. I think you're going to be a motivated patient, so I think you would tend to do the best. By 6 months, I think you could be walking without a limp, and hopefully by 12 months, it feels solid and doesn't bother you on a daily basis. But not only do you fracture, dislocate here through your midfoot, you have other fractures on the outside part of your foot that we wouldn't necessarily put plates and screws in, but again, those all go into cartilage, and I think it's important that you hear that, hey, this foot may bother you for a while.
Now, you said the swelling, you couldn't do the surgery until the swelling has gone down.
I need to take a look at it. The swelling, am I impressed with the swelling or how much it's come down?
How much it's come down.
Yes, I am impressed.
She did good.
Good job. I wanted to tell you what you wanted to hear, so. Yeah, I think it's reasonable. You just got to keep elevating it for me.
Also, I've been trying to put some oils and coconut oils and to try to keep the skin as moist as possible, because isn't that better for you?
Yeah, I would say maybe now just keep elevating it up above your heart as much as you can. Okay. And does that make sense, what I was telling you before? I think it's important that we're, I know it's hard to hear, but it's important that you understand, foot versus motorcycles, a ton of energy. And when you transfer that energy into 5 bones in your foot, it's a lot. It's a huge deal.